My name is Tegan Cheng and I'm an NHMRC Emerging Leader Fellow. So the Epic Lab started in 2016 as a place where we could develop orthopaedic implants for children. So the Epic Lab kind of works in two main areas. We work in orthopaedic implants. So that's where children with congenital deformities or other deformities in their bones just don't have access to implants that either grow with them or use their growth to heal their deformities. And then the other area we're looking at is ankle-foot orthoses or AFOs. And these are plastic braces that go around the foot and ankle. And at the moment, the wait time for these devices is just way too long. And so what we're trying to do is improve the design and delivery of these devices using 3D printing. So an AFO can have a really profound impact on a child's life. I've seen some kids that need an AFO that without them can't walk a single step. And you put them in a pair of AFOs and they can walk 100 meters. That's a huge change in the way that you're able to live your life. We couldn't do what we do without 3D printing. So 3D printing enables us to go through really fast design cycles. Having 3D printers in the lab means we can draw something and print something in one day. So we can either print them and have a look at how they feel in our hands, or put them in a fake bone, and then we use that to develop the design further. And then from there we create a new device. So I'd say my proudest moment was when we developed the wrist fusion plate. And this is a plate we designed specifically for children with cerebral palsy with a wrist flexion deformity. We iterated several times until we were happy with the design. And then we worked with a company to get this plate FDA approved and is now being used in children in the States. Children who have this condition, it can be really hard to do things in your daily life. For instance, getting dressed or having a shower. Being able to straighten your wrist out with this plate can have a huge impact on a child's life. One of the projects we've been working on is working with the pathology department and taking precious samples they have of actual hearts that they use for teaching medical students. And we've immortalized those by CT scanning them and 3D printing them. And what we've been able to do is create a new module for teaching medical students about congenital heart deformities. Not all hospitals have access to them, so being able to send them out and share them is really important. I can honestly say that the Epic Lab wouldn't exist without Hyundai Help for Kids. We have been supported since we first started by Hyundai Help for Kids. We have expanded. We're in a space that's 4 times as big as we used to have. We have several more 3D printers, we have lots of equipment, we have lots of students. We were able to support more projects than we were before, and we've also importantly gained a lot of skill. And I think the ability to pick a research direction based on what we're good at is really important. Well, we wouldn't be in this field if we weren't trying to change lives. Everything we do is trying to change or fix an issue that is affecting a child with a disability or other condition. You know, really what we're trying to do is make some kids' life a little bit better.